Hello, everyone. Welcome to today's webinar, which is part of the Private Water Network Flash webinar series. Thank you for joining us. My name is Reem Tariq. I am the project coordinator at NEHA, and I also serve as the lead administrator for the Private Water Network. Please note that the network is a virtual community for public health professionals and safety workers from various industries that work with private drinking water systems. The mission of the network is to build a sustainable community for people working to protect the public's health from contaminants and private water sources. Membership to the network offers access to a virtual community platform with features such as a discussion forum, a resource library, an events calendar, member directory, newsletters, webinars, and exclusive Q&As from experts in private water quality. And membership to the network is free of cost. The Flash webinar series tend to be a rapid 30-minute presentations with no live Q&A during the webinar. The webinar registrants get to ask questions to the speaker on virtual platform's discussion forum. We call the session the Ask the Expert session. Now on to the webinar. The title of today's webinar is Corrosive Water, Lead and Copper in Private Water Supplies. Our speaker for today is Bryan Swistock. Bryan is a water resource extension specialist in the College of Agricultural Sciences, Department of Ecosystem Science and Management at Penn State University. He received a bachelor's degree in environmental health from Indiana University of Pennsylvania and a master's degree in environmental pollution control from Penn State University. For about 32 years, he's conducted research. He's done teaching and extension programs on emerging water resources issues throughout Pennsylvania. Some housekeeping items before we get into the webinar. This webinar is being recorded. The webinar recording will be uploaded onto the Private Water Network resource library. As mentioned previously, there will be no live Q&A session during the webinar. All questions on the material presented should be asked on the Private Water Network's discussion forum today from 2:30 p.m. Eastern to 5 p.m. At the conclusion of the webinar, you will be directed to a short evaluation. Please do complete that brief survey and provide your feedback, as that is helpful to us. And with that, I will stop sharing the screen and share this. All right. Apologies.
Okay, thanks, Reem. So today I wanted to talk about some of the work we've done here in Pennsylvania and at Penn State on lead and copper and corrosive water in private wells, springs, and cisterns. It's one of the most common problems, or a set of the most common problems that we see in private water systems, and does have some serious health implications for folks who use private water systems. So we've done a fair amount of work on that. And just a little bit of background on private water supplies in Pennsylvania. We have a lot of them. We have about 1 million homes and about 3 million people that use private water systems. So the map here just shows drilled wells that were drilled over about a 30-year period. So you can see lots of dots all over Pennsylvania where private wells were drilled. We find in our research that a lot of these have never been properly tested. A lot of the testing that is done is primarily done during real estate transactions and often only includes things like bacteria. We are one of the few states that don't regulate private water systems in any way. So we have no requirements on construction, on location, on driller certification, on testing, no regulations at all. We have a few county and local ordinances around the state, but the vast majority of the state is unregulated. And so for that reason, it really becomes very important for homeowners that have these water systems to voluntarily understand about the proper maintenance, including the testing and the treatment, and for example, just learning that they need to test for lead and copper and corrosive water and what to do when they do find that those things don't meet standards. So exactly what is corrosive water? It's incredibly complicated, actually. And my old boss used to tell me that there's a handful of people in the United States that actually understand corrosive water. It is a very, very complicated subject. But generally speaking, it's water that's aggressive toward metal. And specifically, when we're talking about drinking water, we're worried about metal plumbing systems. So in most private water system homes, that would be copper pipe that may be joined by lead solder. But it can also be galvanized pipe. It can be pure lead pipe, and even some other less common metals that you might find in metal plumbing. Corrosive water itself doesn't cause any health concerns, so you can drink corrosive water and it's not going to corrode your intestines or your stomach, but it obviously does cause the problems with the metal plumbing, and that can lead to indirect health effects from things like copper and lead or other metals, like zinc, for example, in galvanized pipes that might be included in that plumbing. And so one of the common symptoms we'll see in the bottom right here, you see that bluish green a stain on the sink. That's very common when we have corrosive water. You'll see blue-green, and that's caused by the corrosion of the copper coming out of the plumbing. You also get pinhole leaks, and so you can get a variety of symptoms about this water that might tell you that you have corrosive water. It can be caused by water quality, or it can be caused by electrical current, which we call galvanic corrosion. And again, as I said earlier, this is one of the most common suite of problems that we have in Pennsylvania. We have a lot of corrosive water and therefore a lot of copper and lead issues. The drinking water standards for corrosivity are a recommended standard that water be non-corrosive. So typically that means a neutral or positive corrosion index, and there are a number of different corrosion indices that we'll use, and I'll describe one of those today. For copper, we have a primary maximum contaminant level of 1.3 milligrams per liter because of gastrointestinal illness that can come if you drink water higher than that. There's also a secondary MCL of 1 milligram per liter because of the metallic taste and staining that can come from copper. So copper is one of those rare elements that has both a health-based standard and an aesthetic standard. The health effects are fairly rare with copper because what we find is that when you reach that 1.3 milligram per liter health effect standard, the water starts to taste really bad. And so people will often not drink the water because of the bad taste and therefore avoid the health-related problems from it. But it can cause gastrointestinal upset, vomiting, diarrhea, nausea. Long-term liver and kidney damage can also occur if you're exposed to copper over a long period of time. Lead is a much more serious issue. It has a primary or health-based MCL of 15 micrograms per liter or 0.015 milligrams per liter. This is a very serious health issue. It's been well publicized. Most people are aware of it now. Actually, there's a lot of people that think the drinking water standard should be lower than 15 parts per billion. There's a lot of medical evidence to support that idea that it should be probably 5 or maybe 10 parts per billion. But for a lot of reasons, the action level as it's caused right now, and it's really not a health-based MCL, but it's really an action level where public water supplies have to take action if they exceed that 15 part per billion level on a certain percentage of their homes. The reason it has a concern with health is it is neurotoxic. It causes irreversible brain damage, can cause a lot of other health concerns, especially in children and in fetuses. So we really get concerned about children that are exposed to lead, but even adults exposed to lead can have a lot of health effects from it. The water testing techniques for corrosive water are the fairly standard technique where you flush the lines out for 5 to 10 minutes and then capture a sample in a bottle, deliver it to a lab, and corrosion is normally calculated from one of the various corrosion indices, and those usually require things like pH, total dissolved solids, alkalinity, hardness, temperature. Some of the other indices require sulfate and chloride to actually do a corrosion index. For copper, the standard method, as with lead, is a first draw sample where you draw the first water out of the spigot in the morning as the water that has sat in the pipe overnight. And we're really collecting kind of a worst case scenario. What's the highest concentration that might occur? Because as the water sits in the pipe, the concentration of lead and copper will build up over time. And so we typically see the highest concentration from water that has sat in the plumbing. And then as you turn the faucet on, you start to reduce that concentration as you draw fresh water out of the well or the spring or the cistern. Typically speaking, in homes with private water systems, we see very rare cases where copper and lead are actually occurring in the groundwater. So in the vast majority of cases, it's coming from the plumbing. And so that worst case scenario is shown out in this first draw sample. With lead, one of the research studies that we did years ago was to look at total versus dissolved lead. And we found that it was very important to be measuring total lead because from a physiological perspective, your body can't handle either particulate lead or dissolved lead. So they're both very important. So we want to know what is the total lead burden in the water, not just the dissolved lead. And in this particular study, we looked at a bunch of different water wells all across Pennsylvania and measured both the dissolved lead, and then we digested the sample and looked at the total lead. And we found that the total lead concentrations were about 6 to 20 micrograms per liter higher than the dissolved lead. And so there again, with all forms of lead being toxic, we don't want to underestimate the lead by just doing the dissolved component. And so if you're looking at water test results for lead, it is important that you either account for this increase. If you see a dissolved lead concentration, keep in mind that the total lead may be a little bit higher than that. But preferably you're getting actually the total lead tested rather than just the dissolved. Now, as far as corrosive water goes, so the index that we use most frequently is called the Langelier Saturation Index, or LSI. Again, there are other corrosion indices available, but this is the one that we have found to be probably the most predictive of lead and copper corrosion here in Pennsylvania. So it does include pH as an important component, but one of the most common misconceptions is that corrosion is all about pH. And that if you have a low pH, you have corrosive water, and if you don't have a low pH, you don't have corrosive water. And that's an oversimplification for sure. We see lots of cases where people have neutral pHs or even slightly alkaline pHs above 7.0 and can still have quite corrosive water. So pH is important, but it doesn't explain all of it. There's a number of other water quality parameters that are included here, and basically what we're doing is looking at the calcium carbonate saturation here and looking at whether the water is going to dissolve or deposit calcium carbonate within the plumbing system. So we calculate a pH of saturation, and again, taking into account the total dissolved solids, the hardness, the alkalinity, and what we come up with is basically an LSI number where less than 0 is aggressive or corrosive water, 0 is balanced water, and anything greater than 0 would be scale-forming water, so it would be the opposite of corrosive water. And we can even break that down a little further with the LSI index and say negative 0.5 to negative 1 is mildly corrosive, negative 1 to negative 2 moderately corrosive, and then below negative 0.2 we get into highly corrosive. And we occasionally see numbers in the negative 5 and negative 6 range, which is just extremely corrosive water toward metals. Some of the limitations of the Langelier Saturation Index, it is not perfect, and there is no perfect index of corrosivity. Ultimately, we're still going to want to look at those lead and copper numbers to get a true reading of what's going on. But if we're just trying to use corrosivity, there's nothing perfect about this or any other index. It works pretty well here in Pennsylvania, and that's why it's our preferred index for private water systems. It's most predictive for corrosivity for water that has more than 40 milligrams per liter of alkalinity and a pH of 6.5 to 9.5. So that does encompass the vast majority of the groundwater we see here in this state. And for unusual water supplies, things that have soft water with high pHs or unusual calcium complexes, you can get pretty poor predictions from the LSI. So you have to always take these numbers with a grain of salt, but it is kind of the best that we have available. At least we think it's the best for what we do here in Pennsylvania. So I want to show you some results we have from some various studies that we've looked at copper and lead and corrosivity, a variety of studies going back into the mid-'80s where we've done anywhere from about 700 to almost 2,000 private water systems, depending on the study. And we've looked at things like pH, corrosivity, copper, both first draw and running water copper, and first draw and running lead. And we've been able to learn quite a bit actually about lead and copper and corrosive water. First of all, like I said before, generally speaking with the LSI index, pH is very important. And so we see that on this graphic that as we go with lower pHs, especially below 7, we start to get into those lower LSI numbers of negative 2 to negative 6 range when we get down below 7. But you can see that even out here at a pH of 8, you can have an LSI of negative 2 under certain circumstances. So again, pH is a big part of the LSI index, but it's not perfect, and we should never just use pH to say whether water's corrosive and whether water's going to be a problem for lead and copper just based purely on the pH. That's a gross oversimplification. And in fact, if we look at the standards for corrosive water, so with the LSI, anything less than negative 0.5 is corrosive, and with pH, anything less than 6.5 is considered to not meet the pH standard. And if we look just at that, in Pennsylvania, if we look at these two different data sets, about 10 to 20% of the private water systems fail the pH standard, but about 60% fail the corrosive water standard. So in other words, they have an LSI lower than negative 0.5. So we, again, very largely underestimate corrosion if we're just looking at that pH standard and just worrying about pHs less than 6.5. We have a lot of corrosive water, again, about 3 times more corrosive water than we just have low pHs if we look just at the standards. Now, if we shift over to looking at copper and lead, first of all, copper, the one study that we had from the mid-'80s found that copper was above the MCL about 2% of the time in running water samples. So again, that's running water. So that's water coming right out of the ground. Only about 2% had high copper when we looked at about 700 water supplies. Now, the Penn State Ag Analytical Services Lab has a very large data set, which they've been compiling since the early 2000s. They find that it's about 1% of the running water samples actually exceed the copper standard. Now, an important caveat here is these are samples that are collected by the homeowner. So when we say it's a running water sample, it's always possible that they didn't run the water long enough to properly flush out their plumbing. So these are probably overestimates. Actually, if you had a professional collecting these samples, we would probably have far less than 1% of the high copper concentrations coming from running water samples. So again, it's a biased result. These are non-random, they're collected by homeowners, but that 1 to 2% range of running water copper being above the MCL, that's kind of a ceiling on probably the highest that we're going to see. When we look at first draw samples from our Ag Analytical Lab, which is based on thousands of drinking water samples, about 22% exceed the 1 milligram per liter copper standard, the recommended standard, and just under 20% exceed the 1.3 milligram per liter health-based standard. 4% actually exceed 5 milligrams per liter of copper. And that's just a random number that I put on here just to show you that we do occasionally get some extraordinarily high copper concentrations. You would get very sick if you drank water with that much copper in it, and it probably would not taste very good either. So overall, it's not unusual to find copper above the MCL in first draw samples. Again, about 20% or so have high copper in the first draw. Less than 1%, though, probably occur in the running water. So this is looking again at correlating copper and the corrosion index, the LSI. So on the horizontal axis, we have our corrosion index. Again, more negative being more corrosive. And this is showing the first draw copper from about 1,500 samples from our Ag Analytical Lab here at Penn State. And you notice that the higher copper concentrations are all occurring where the corrosion index is generally less than about -1.5 or so is where we really pick up the very highest copper. You do certainly have some copper concentrations above the MCLs, even when the LSI is -0.5, and even an occasional case where there's a positive LSI and you get a high copper. So again, it's not a perfect index, but it does a pretty good job. If you look at the vast majority of the high copper concentrations on here, they're occurring where we have corrosion indices less than -0.5, which is by definition a corrosion index that doesn't meet the standard. Now, when we shift over to lead, the regulations to remove lead from plumbing have been widely publicized. We had the Safe Drinking Water Act in 1986 that reduced solders and flux concentrations of lead down to less than 0.2%, and fixtures had to be less than 8% lead. We had the lead and copper rule in 1991 that increased monitoring and treatment of public water systems. Again, not relating at all to private water systems, but like so many things, everything we do with private systems, we kind of take the cue from what happens in public systems. And so when all this was occurring with public systems, we started a lot of our work on lead with private systems. In 2011, there was the Safe Drinking Water Act amendment, which went into effect in 2014, which redefined what lead-free was, reduced the 8% fixture maximum down to 0.25%. One of the reasons for that was we were noticing that we saw a lot of new homes actually that still had fairly high lead in their first draw sample, and it was coming from the faucet. If you think about it, that little bit of water that you collect in our first draw sample is dominated by what's in the faucet and the first few feet of pipe below that. So the faucets become very important and the fixtures become very important when you're looking at a first draw sample. There was also a provision in here to provide exemptions for non-potable water plumbing as well. Since people aren't drinking it, you could have some exemptions on what was allowable as far as lead. What we've seen in Pennsylvania as far as the historical occurrence of lead in private water systems, the first study we did was actually collected in the late 1980s, and we published it in 1990. And we found that 19% of the private water systems in Pennsylvania failed the drinking water standard of 15 parts per billion for lead. In 2007, we did another statewide testing of about 700 homes and found that 12% exceeded the drinking water standard. And then in 2018, and actually this study is still ongoing, but we have about another 800 water supplies across the state, and we're just under 9%. So we see a general reduction. Now, these are not the same homes, so this is not a perfect way to look at this, but these are fairly random samples of private water systems across the state. And we see that we've been able to cut the lead failure rate for drinking water for private drinking water supplies from 19% down to about 9% over about a couple decade period. And most of that can be related back to the reductions from the federal copper and lead rule, because even private water systems now could not have lead solder in them. They had to reduce the amount of lead in the fixtures, just like you would with public systems. So everything that went into effect for municipal systems also started to affect private systems and help to reduce the lead concentrations even in private water supplies. So as far as the correlation between lead and corrosive water, we had 701 water wells that we looked at in 2006 and 2007. Again, 12% failed the drinking water standard of 15 parts per billion. So that was 84 homes out of the 701 had excessive amounts of lead. We were able to correlate the lead to both the geology of the rock type where the water was originating from, which basically goes back to whether it was corrosive or not. We didn't have water corrosivity measures, but we had the geology, and we could tell that if water came from certain geologic formations, we knew it was much more likely to be corrosive as opposed to water coming from something like limestone, which is typically non-corrosive. So there was a strong correlation to the geology of the rock type where the water was coming from, and also whether the household had metal or plastic plumbing. Those were important considerations when we found a home that had high lead. We found 93% of the high lead occurred when the pH was less than 7. 80% occurred when the water supply was soft. In other words, it had very little calcium, very little alkalinity or hardness. And 70% occurred in homes where the plumbing was installed prior to 1991, which was an important year for the lead and copper rule to start removing lead solders from plumbing. Overall, when we looked at all these different factors across these 84 homes that had high lead, we found only one home where we really couldn't explain the high lead based on corrosion. So there was one case where it appeared as though it might be a groundwater contamination problem, which can happen. You can have old landfills and dumps where maybe batteries were disposed of, or industry that's dumping something that's got lead in it, or even the very rare case of naturally occurring lead. But in this case, 83 out of the 84 homes, we could say the lead was coming from the plumbing system and from corrosion of that plumbing system. Furthermore, if we looked at first draw lead and corrosive water, we saw pretty good correlations where the high lead concentrations are occurring. And I should say this is a different study. I've switched gears here back to the ag analytical data. But we do see strong correlations between the LSI and the first draw lead, just like we did with copper, where the vast majority of the high lead concentrations are occurring where those LSI indices are getting more and more negative. And so there's a strong correlation there. Now, again, we see all these numbers along the bottom where there's very corrosive water and there's very low lead. And those are typically cases where you have plastic plumbing. So you have PVC, you have PEX plumbing, and you have fixtures that don't have any lead or very little lead in them. So there's no sources of lead in the plumbing system. So even though you have tremendously corrosive water, there's no lead to corrode from the plumbing system. And so we get very low concentrations regardless of the LSI. Testing is incredibly important, especially with something like lead, because it doesn't provide any obvious taste or smell in the water. You can have lots of lead and the water will taste just fine. It becomes very important for people to test their water. And the point of this graphic is to show you awareness of private water system owners for different pollutants in their water. So the way that we can interpret this graphic is along the bottom, we have different water test parameters from coliform bacteria to nitrate and lead and arsenic. And then we have the percent on the vertical axis that were aware of the problem before their water was tested. So we see that anywhere from 11 to 18% of homeowners that have coliform bacteria and E. coli actually knew that they had those in their water before we tested their water. And that's probably because they had tested it previously as part of a real estate transaction or something else, and they already knew that they had bacteria because that's the most common water test that's done. 20% knew they had pH problems, 31% knew they had nitrate problems, but 0% knew they had lead. So 0 out of 84 homeowners that had excessive amounts of lead were aware that that lead was there because they had never tested their water for lead. And there were no obvious symptoms of lead in their water, so they had no reason to think that there was lead. Arsenic is also quite low. 8% of people with high arsenic knew that they had it. 0% of the people with pesticides knew that they had those because, again, arsenic pesticides are not common water tests that are done. So for these symptomless health-related pollutants, testing becomes incredibly important to show that these are occurring. Whereas aesthetic pollutants like iron and hard water and manganese and hydrogen sulfide, these are all things that are readily apparent, and you often don't even need to test the water to know that you've got these problems and you need to put a water treatment device in. And so that's where water treatment becomes very important. I'll show you a graphic of that here in a moment. The other thing I wanted to point out was how important running the water is in reducing copper and lead concentrations. This graphic shows first draw copper on the vertical axis versus running water copper on the horizontal axis. And what you find is that in 98% of the cases, we can reduce high copper concentrations down below the standards by simply running the water for a minute. And that makes sense because the copper is coming from the plumbing. If we flush the plumbing out and start to draw fresh water from the well, which normally takes about 1 minute in most homes, if it's a really big home, it might take a couple of minutes to flush all the plumbing, but we can get that fresh water from the well and it'll have virtually no copper in it. Same with lead. What we found with lead was it was 96% effective. By just running the water, we could reduce 85 of 89 high lead samples down to below the drinking water standard. And excuse me, this is copper in the first bullet, I misspoke. This is a different data set for ag analytical, but in this case, 96% were effective for copper, 96% were also effective for reducing lead concentrations down below the drinking water standards. The only problems with running the water is it's wasteful if you do it every single time, and you don't need to. It does take a period of time for the lead and copper to build up in water that's sitting in the pipes, so you don't need to flush the pipes every single time. But if the water's been sitting for an hour or more, you probably should. And the best thing to do is just go out in the morning, flush the pipes out by running the water, collect some drinking water in a pitcher, put that in the refrigerator, and use that for your drinking throughout the day, rather than just flushing the pipes every single time. The other concern with not addressing this through treatment or through changing the plumbing system is that as long as there's corrosion going on, you're damaging the metal plumbing system. And so you're more likely to cause leaks in the plumbing by allowing corrosion to continue. So yes, while running the water does allow us to avoid the health effects of copper and lead, it still wastes a lot of water and it still does damage the plumbing system. And that's where treatment becomes very important. However, we find that relatively few people treat for corrosive water. In Pennsylvania, we have found in our studies 53% of people with a private water system have at least one water treatment device. The vast majority are water softeners and sediment filters, but you notice all the way out there on the right, acid neutralizers, which is the standard technique to treat corrosive water, is only about 1 to 2% of the homes. So very, very unusual to see corrosion control in homes. Even though they might have corrosive water, they don't install these acid neutralizers because it can take many decades for the pinhole leaks to develop. The blue-green stains may not mean anything to folks if they even see them, and so they may not even notice that they have a problem, and they never test for corrosive water, lead, and copper, so they have no reason to know that they would need an acid neutralizer. There are some other treatment systems in place like RO units and distillation units that can help to remove the copper and the lead from the water, but we're still not actually treating the corrosive water origin of the problem. So in summary, I can't stress enough how important testing is for people that might have copper and lead and corrosive water issues. Lead especially is an extremely toxic metal, especially to children, and the only way you're going to know you have it is to test your water. That's true even for folks on public water supplies. Even though your municipality might say you have a very low incidence of lead, the only way to know for sure that your home doesn't have a lead problem is to test the water, because you're not going to notice the stains or the taste or anything about it. They can occur in any home, and corrosivity is an important component of that. That's where you have a combination of soft water and acidic water. If you have that in a home that's got copper plumbing, especially prior to 1990, if you're noticing any blue-green stains or pinhole leaks, if you have persistent gastrointestinal symptoms, and if there are children or pregnant women in the home, these are all good reasons, especially good reasons, to do some testing for copper and lead and corrosive water. Really, it's a good idea for everybody, but this kind of gives you a hierarchy of where is it most important. These combinations really are places where we're most concerned. And really, the simplest way to avoid it, it's free, basically, is just to run the water. You can avoid copper and lead issues. You don't address the corrosive water problem, but at least you're able to avoid the health effects by simply running the water. It's best if you can do a water test of the running water just to confirm that you have addressed the problem by running it. But again, we find 98% or more of our homes are solved by just running the water. And then finally, there are rare cases where you can get copper and lead in groundwater. That's where something like reverse osmosis or distillation treatment systems would be useful to actually remove those metals from the groundwater itself. This is our Penn State Extension drinking water website, so extension.psu.edu/water, and you can click on drinking and residential water. We have fact sheets and videos on lead, on copper, on corrosive water, and a lot of other private well, spring, and cistern publications as well. So with that, I will stop the presentation today. We will be able to handle questions and answers on the private water network until 5 p.m. So feel free to ask your questions, and we'll be checking in on those and providing answers. So thank you.
Thank you, Bryan, for that informational and timely presentation since this week is National Lead Poisoning Prevention Week. Thank you to all the attendees for joining us today. I'm going to quickly launch a poll right now. Please do take the poll because it'll help us plan for future webinars. And as you're taking the poll, please be mindful that you can select multiple options on it. I've got some options listed there on what you'd like to watch next. I'll give you a couple of seconds to take the poll, and thank you so much. I see that you all are taking it right now. And with that, just a couple of reminders. I just want to remind you that you can ask questions on the content of the webinar on the discussion forum for the network at www.privatewaternetwork.org. And we will be taking questions until 5 p.m. Eastern today. As mentioned previously, please do not forget to take the survey that will pop up right after this webinar. We really do value your feedback, such as your feedback via the poll right now. That's important. And with that, I think everyone's had a chance to take the poll, so thank you for that. And I just want to thank you all for joining today's webinar, and hope to see you on the virtual platform for the Private Water Network.